Hello to all my United Healthcare Medicare Advantage clients. This is Marc Robertson, your agent from Bridalwood Insurance. And I apologize in advance that I have a skit here that I had to write up. I have to do 8 of these for all the different situations for my different clients. So I do have to read portions of this, so my eyes will wander over to the skit like this. It's just the way it has to be done. I got to get this out to my October newsletter, which you're reading right now. And hopefully you were able to scan this and watch this. So you have an HMO or a PPO with United Healthcare, and then you should have your drug plan embedded into that plan, your Part D for drugs. You don't pay a separate premium for that. Okay, so hopefully you got a chance to read my flyer, knew this was coming. It explains why in 2025 there are going to be some significant changes in plans across the board. Remember, this is not a United Healthcare issue. They did not do this to you. This is the federal government, the CMS, the Centers for Medicare Services, the ones that did this, and it affects all the plans. So changing plans or providers will not fix this, okay? So we're gonna have to roll with the punches. We've had it good for a long time, and now they're finally making a few changes that's gonna up a few of the costs, okay? So that's why I'm getting to you and talking to you about this. I will always have you on the best plan possible. I will always look over your stuff with you, chat with you, whatever we need to do to make sure you're happy with what's going on. I just wanted to get out in front of this as much as I could before annual enrollment period starts, and just let you know that there are going to be some significant changes in 2025 that will affect almost everybody, okay? So the ANOC, that's your annual notice of change. You should have got that in the mail hopefully a couple weeks ago, telling you what's happening, what's changing on your plan. And that's kind of why I'm doing this video as well, because you're reading your ANOC and you're thinking, what the heck? So I want you to know that I'm aware of everything that's happening. So for example, for my United Healthcare people, you have, for the upcoming year, you have dental is preventative only now. There is no $1,000 allowance. You don't get $1,000 to go use at the dentist's office. You get all the preventative dental stuff, all zero copay, but the $1,000 went away. Also, the big one is the drug plan. So this is what happened. The drug plans now, if you take tier 1 and tier 2 drugs, which are generic drugs, the blood pressure drugs and the not so exciting brand name drugs, if you take those, there is no deductible. If you stay on those, you're going to be fine. Remember, I tell most of my clients, Medicare hates brand name drugs. Well, here you go. So if you take a brand name drug or a tier 3, 4, or 5 drug, which is the heavy hitters and the brand name stuff, they are going to charge you a yearly deductible. I think for United Healthcare, it's $255 a year. So you're going to have to pay the copay on those drugs and satisfy that deductible as well. Okay, there's no more coverage gap, so your maximum out of pocket is lowered down to $2,000 instead of $8,000 now. So it benefits you, but it's also, we can get into that if you'd like. Give me a call and I'll explain kind of exactly what happened. I explained it a little bit in my flyer, but just know if you take the tiers 1 and then tier 2, you're going to be okay. If you take anything more than that, you're going to pay the deductible, okay? The good thing about the plans is the over-the-counter benefit, that thing you get every 3 months. I don't know if you utilize it or not, but you should, because it's free money, it's free stuff. It's stuff you pick up at CVS and stuff like that. That's going up on all the plans. I'm not going to give you a dollar amount because it's different for every plan, but it did go up, okay? So that is one good thing that did happen. Thank gosh. Everything else is a mess. So last couple things. The way to contact me, please be patient with me. I have hundreds and hundreds of clients now. Thanks to all of you. I really appreciate it. But I'm a busy, busy boy. So the next 3 months are going to be crazy, working 1,000,000 hours. So if you can contact me through my website, that would really help me. Now, if you can't, and you have to contact me with email, a phone call, or a text, that's fine. I'm going to still get back to you. I'm still going to answer your phone calls. I'm just trying to keep track of everybody that I've talked to, and the way to do that is to contact me through my website. Now, my website is www.themedicareagent.net. So, themedicareagent.net. Okay, and then as soon as you click on that, there's a Contact Us tab right on the very first page. It says Contact Us. Click on that. You fill out the little form, and it messages me, and then I'll get back to you. I'll put you on my calendar, and I'll get back to you within a day or two, okay? And then we can talk about if you need to come in or what you need to do, okay? So that's how I would appreciate it. If you could do that. If you can't, you can't. It's not a big deal. If you're outside of California, if you're one of my clients in one of the many states that I do, you have to contact me. I want to talk to you. I want to make sure that you're still on the right plan. So we have to go over it. If you're one of my local UHC, United Healthcare clients, we don't have to talk. I kind of told you what's happening, and it's in your annual notice of change brochure. So if you don't want to deal with it and you just want to roll on to the next year, that's fine. The plans are pretty much the same next year, except for they all kind of changed in that. But if you change to another United Healthcare plan, you're not going to miss out on the deductible. You're not going to get your dental back. So you're probably on the right plan already. If you're not, I will contact you, okay? I'm going over everything, just letting you know. Now, annual enrollment period is from October 15th through December 7th. So from October 15th through December 7th, that's when we make these changes, and they're effective for January 1st, 2025, okay? So if we do make a change, that's when it'll be effective for you. I have to do it between October 15th and December 7th, okay? My phone number, my email, all my stuff will be at the bottom of this, should be. I'm gonna have my marketing person take care of it, put it at the bottom of this video. So it should all be there, easy to contact me. Use my website if you can. I really appreciate all my clients that have trusted me with their health care. I really appreciate it. And I'll talk to you sometime during AEP. Wish me luck and God bless.